The Ebola outbreak really taught us two things. The first is that didn't have to be the way that it was, and I'll actually answer that in some more detail. The second was that it could have been a whole lot worse. From the standpoint of it didn't need to happen the way that it did, there are several aspects to that. The first is that in West Africa and the countries that had the outbreak, the ability to detect it wasn't really in place. So there was a 3-month period when cases were occurring and it wasn't known that Ebola was even in that part of the world. So that initial ability to detect. Secondly, once it was detected, the response wasn't what it needed to be to control it, obviously in retrospect. And that was both at the country level and at the international level, that the international response wasn't sufficient to bring the outbreak under control. And by the time it was recognized as being the problem that it was in July and August of 2014, it was just a whole lot more difficult to control. The number of cases that were occurring, those chains of transmission that were happening all over the place in the 3 highly affected countries. And so putting in place measures to detect and respond effectively, and both at the country level and at the international response. So the second part of the learning was that that it could have been much, much worse. And it's really, I think, kind of an unrecognized good part of a really terrible situation. But in August of 2014, a case was detected in Lagos, Nigeria. Lagos has a population greater than all 3 of the countries that were highly affected, but a rapid response by the Nigerian Ministry of Health contained that outbreak. There were hundreds, over 800 cases, or sort of contacts that needed to be followed, just following a very small number of cases. Ultimately, 20 cases occurred in Lagos and also in Port Harcourt in the eastern part of Nigeria. But it's part of the story that is kind of not something that's properly well known, that in Nigeria it was really a near miss, and an effective emergency operations center that was able to mobilize quickly to do contact tracing and to isolate cases brought that outbreak under control. Really the response to that is to work with ministries of health and really the global community to develop the capabilities to detect and respond rapidly, and in situations where it's possible to prevent outbreaks from occurring, putting those measures in place. So the ability to detect, respond, and prevent for cases that, for instances where those outbreaks are preventable, there's a major effort underway, a global effort underway. It's called the Global Health Security Agenda. And this is, I think, one of the main positive legacies of the Ebola outbreak.